I'm Dr. Andrew Blecher, and I specialize in sports medicine. I have been practicing at the Southern California Orthopedic Institute for 10 years, where I've had the opportunity to care for athletes of all walks of life, from age 8 to age 80. Unfortunately, there's no way to prevent concussions unless you're just not going to participate in contact sports. As soon as we step on the field of play, there's a risk of concussion. However, we can try to reduce the incidence of concussion by doing several things. Number one, we want to teach proper technique, such as in football, tackling technique is extremely important, teaching kids not to lead with their head to avoid the risk of head injury. Proper equipment is also very important. Finally, we want to make sure that education and awareness is taught throughout all levels, from the athlete to the parent to the coaches. We want to make sure that we're aware to look for concussions so that if any signs or symptoms, these athletes seek prompt treatment, get evaluated, and make sure they're taken care of before we're risking further damage. Concussions are diagnosed predominantly on their signs and symptoms. As we discussed, the alteration in brain function leads to symptoms and signs that we can see in the athlete. These include things like loss of consciousness, which is typically the symptom associated with concussion. However, loss of consciousness is not necessary to obtain a concussion. In fact, the most common concussions do not even involve loss of consciousness. They may involve memory problems such as post-traumatic amnesia. They can also involve confusion, dizziness, nausea, headaches. The typical scenario is a football player who comes over to the sideline feeling like he got his bell rung or feel like he got dinged. Something is just not quite right. We then try to diagnose the concussion using some type of testing. Our diagnostic tests include, number one, doing a full physical exam to look for any neurologic deficits. We will also do balance testing, and there are several ways to do this. Additionally, we want to do some type of cognitive testing to assess brain function. The standard concussion assessment tool is one way to do that. Another way is through computerized neuropsych testing. IMPACT is one such type test, and that is the type of neuropsych testing that we use here at SCOE. IMPACT is a computerized neuropsych testing platform. It is performed on the computer, and what it does is it tests the athlete in several areas, including concentration, memory, attention, and reaction time. It's almost like playing a video game. The athlete follows commands on the computer and tries to get answers right or wrong. In addition to obtaining information as whether they obtain the right answer, we're also able to measure how quickly it took the athlete to obtain the right answer. And by looking at the variability between their scores, this provides us a lot of information to tell us how the brain is functioning. By comparing these results to a baseline test that the athlete took before he sustained a concussion, we can help determine where he or she is in their recovery. If an athlete is showing any signs or symptoms of a concussion or other head injury, they should discontinue playing sports and seek evaluation and treatment immediately. Concussions are something that must be taken seriously.